So let's go to the first slide. So we started speaking about medication last class, and today we'll continue speaking about medication. And so we start with some comments on your homework. So you were given the task to do some matching exercises with phrasal verbs. And there was one of the exercises which was called phrasal verbs in medicine. And the task was to find, so a pair, the phrasal verb which matches to its meaning. So, and there were some mistakes here, and I would like you to focus just to understand the difference in the meaning of these three phrasal verbs. So, flare up, it means suddenly appear or reappear. We can say this about a disease, for example, a pandemic, so something else. Then become conscious again, come around. So we can say this about a patient. And spread from person to person to go around. This is also about infectious diseases. So we've mixed these words like flare up and that was come around. There were mistakes in the use of these phrasal verbs. And if we have a look at the next slide, so here there was also a task to differentiate between the phrasal verbs clear out and clear up. So we used to use clear up or clear out some issues, but here, so clear out, to leave a place quickly. So for example, like he cleared out with all the money and left her with the kids. This is the meaning of clear out. Clear up means to become fine, to disappear when we speak of an illness, infection. And the example, the sky cleared up after the rain. And actually clear in is not a phrasal verb, and the example of the use of this phrase is the diagnosis was clearer in the first phase of the study. And here the sentence was Elaine's rash began to clear. What should we use? Which preposition should we use here?
Clear up, ma'am.
Clear up, yes, after she started using the cream. Yes, so that was the correct option which you have, which you should have used. And so today we continue speaking about aspirin. You remember that last class we were listening to the conversation between a doctor and his patient, and the doctor was describing the prescriptions. He was speaking about aspirin, and he was speaking about its benefits and also about side effects. Yes. And so I hope you remember this information, and anyway, you know this. I would like you to explain the benefits and side effects of aspirin using these phrases. First, I'd like to, like you are talking to a patient, will help you a lot as it, and you should say the reason. So helps to prevent. I just have to point out, sometimes people get, or it can make, or it can cause. And the final phrase, would you like to go through? So who remembers this information and who can just describe aspirin? Any volunteers? I mean, you can do this. Yes. I mean,
Ma'am, it's Prerna.
Prerna, okay. So Prerna, please.
He first talks about the progress and non-progress about the patient, and he asks him to feel free and tell him about his problem. And also the doctor tells that whatever he has to take by mouth or by water or anything, and then he explains that he might get some blood or he might get an upset stomach and dark colored stool. So these were the side effects the doctor told to the patient.
Mhm. So, and if you speak on behalf of the doctor, you would say it will help you a lot. As it, for example, as it thins the blood, right? So
Yes, ma'am.
it helps to prevent what? What does it help to prevent?
Heart attacks and stroke.
Yes, yes,
Ma'am,
exactly.
heart attacks.
Mm,
Heart attacks.
yes, okay. So if we move to this slide, here we can see these side effects in the diagram, side effects of aspirin. So look at these just effects, and will you just say something else about? Yes, Samhita?
Ma'am, can I rejoin after 2 minutes? My network is not working. My Wi-Fi is not working, so the screen is blank.
You do. What do you suggest to read from where?
Ma'am, actually, can I rejoin in 2 minutes? Can I rejoin the meeting? My network is not working.
So yes, sure, of course.
Thank you, ma'am.
Okay. Well, Arunchalam, what can you tell us about side effects of aspirin?
Ma'am, aspirin, actually, it is banned in even some countries, ma'am, because of its bad effects on the body, ma'am. Because it can also reduce the risk of heart problems like that, ma'am. But it is risk using, ma'am, because it can irritate the stomach lining, ma'am. Because it's very strong antibiotic, ma'am, medicine. And side effects are there are many side effects in aspirin, ma'am. Like we can also tell that the person who's having the intake of aspirin can have some rashes, also have some abdominal pain, and also some drowsiness or headache, cramping like that, ma'am.
I see.
Nausea, vomiting, and etc.
Good. And in India, is it banned in your country?
No, ma'am.
No, it is available.
But ma'am, it has a binding that you can get aspirin just only by prescription,
Exactly.
not like that.
Ma'am.
Right. Okay. Good. Now, if we go on, so we continue speaking about phrasal verbs. So in details, and so here we have the phrasal verbs with the verb run. So you see how the meaning of the verb changes depending on the preposition which is used with this verb. So we have several phrasal verbs here, like run into. Run into means to meet someone unexpectedly. And the example says, I run into my English teacher at the shop. So if we use the preposition through, so it means explain quickly, run through. Let me run through the schedule for the show means let me explain you something. Run on means be powered by. Electric cars run on electricity, not gas. Mhm. So then there is a run up, spend a lot of money on credit. I run up a debt of £10,000 on my credit cards. And run out of means have none left. We need to buy more eggs because we have run out. Well, and this is like general information, and what we heard in the conversation of a doctor to a patient, there was one of the phrases used by the doctor. He says, there's a lot of information to take in at one time. And here we have the verb take and preposition in, and they form the phrasal verb to take in. The verb to take in means to understand. So it is so-called separable phrasal verb. Why? Because you can separate the verb take and the particle in. So they can be used together, like in the example. It is difficult to take in information. So verb plus particle, they are used together. But we can also change the order of words, and we can use it in a different way. So it is difficult to take information in. So the verb and the particle are separated, and the sentence still makes sense and it is used correctly. So separable phrasal verb. And there was a verb to get up. And get up is inseparable phrasal verb because you cannot separate the verb and the particle. So example, if you can take the medication soon after you get up in the morning. So get up should be used together. We can't use any words in between them. And these are examples from the conversation. And if we speak about the the phrasal verbs as a grammar issue, so let us summarize what we already know. I hope you remember that phrasal verbs in English are transitive and intransitive. So here in the diagram, you can see this division. So transitive means they have a direct object. And intransitive, they have no direct object. So the example of intransitive phrasal verb is I get up at 6 o'clock. I get up, so no additional information. So we can say get up, no additional object to this verb. And so transitive phrasal verbs can be separable or inseparable. So, and the example of separable transitive phrasal verb is here. Turn off the TV. TV is a direct object. And as far as it is separable, we can separate it and we can use, for example, pronoun it between the verb and the particle, turn it off. So we can separate the parts of the phrasal verb. And so inseparable transitive verbs, I look after him. So we shouldn't use him after look, before after. And intransitive phrasal verbs cannot be separated. So get up cannot be separated. So, and there are more examples here about separable transitive phrasal verbs. Example, call the appointment off. So we can also use call off the appointment, and the sentence is correct. Is a phrasal verb separable? It must be separated when its object is a pronoun. Instead of the appointment, we use it, a pronoun. So we should separate the phrasal verb, call it off. If we use like call off it, it is incorrect. And so inseparable transitive phrasal verbs, examples are here. She's just starting to get over the flu, to recover. So we can change the flu into it. And we should use it after the phrasal verb. She's just starting to get over it. But we can't use it between the verb and the particle because it is inseparable. So the sentence, she is just starting to get the flu over, is incorrect. And so more examples with inseparable intransitive phrasal verbs, which have no direct object. So when we visited Paris, we loved eating out in the sidewalk cafes. Eat out means dine in a restaurant. So nothing is used between the verb and the particle. And another example says, day after day, a friend showed up for class 20 minutes late. Show up, to arrive. So show up is also inseparable intransitive phrasal verb. Some phrasal verbs always have to be separated, but this is comparatively rare. Example, Oscar will take Sven up on the offer. Means just accept the offer. Well, this is the theoretical information, and let us have a look at the practical exercise. As you see, we have some phrasal verbs: take out, write out, point out, cut down, look at, get in touch with, get, enter. And we should rewrite the sentences using the phrasal verbs. You may have to change the form of the verb, and you may be able to separate the particle from the verb. So if we have a look at the first sentence, Madhumita, will you read it, please?
The doctor identified a few benefits and a few side effects. It can be the doctor pointed out a few benefits and a few side effects.
Yes, exactly. All right. So please, a couple of minutes to you just to change, to rewrite the sentences using the phrasal verbs. Do it individually, please. Start, please. Well, are we ready to start to check? Have you done?
Yes, ma'am.
Okay, so Divya, please. Sentence number 2 is for you. Divya? Has she come to the class? No, she's absent. So Priya, please.
Yes, ma'am. You should fill box with the days of week on it and remove the tablets each day. Instead of remove, it will be cut down.
Cut down means to make it less or shorter. And here,
Take out.
take out the tablets each day, yes, from the pill box. Okay, so Rajkumar, Badris, are they here? No. Prerna Mugam, please. Prerna?
Yes, ma'am. Completing a prescription requires great care. So, ma'am, it can be getting into a prescription requires great care.
This is the sentence about a doctor. So what does a doctor do with a prescription?
It is writing. It
Yes.
is writing out the
Write out.
prescription.
He writes out. So it should be gerund here, writing out a prescription.
Writing out a prescription requires great care.
Okay. So Nishat?
Yes, ma'am.
Mhm.
Don't forget to read the instruction on the label. Ma'am, don't forget to look at the instruction on the label.
Exactly. So Prakriti,
Look
please.
at.
Yes, I see. Prakriti, number 5.
Yes, ma'am. Try to adopt a routine for taking medication if you can. Ma'am, try to take out a routine for taking medication if you can.
Take out was already in the second sentence. Can you think of any other phrasal verb? So
Yes, ma'am. It should be get in.
yes.
Routine.
Getting
What is-
into
Get in.
Yes.
Yes, ma'am.
Try to get into a routine. Okay, Samhita, please.
Contact the hospital immediately if anything changes. Get in touch with the hospital immediately if anything changes.
Exactly. Okay, so Rafael.
Yes, ma'am. It works by reducing the workload of the heart. It works by cutting down the workload of the heart.
Yes, here cutting down. Okay, so these are the meanings of some of the phrasal verbs. And now we continue speaking about concordance. As you remember, we read the article about nurse practitioner, and she mentioned this term concordance. And I hope you remember that this is a kind of agreement between a doctor and a patient about taking the medication. And so it's a very important issue. And there is some statistics for concordance in general practice in the United Kingdom here on this slide. So let us read it. So I mean, will you read it, please?
Yes, ma'am. Reading concordance, statistics for concordance in general practice in UK. So sufficient concordance to attain therapeutic objectives occur about 50% of the time. 1:6 patients take medicines exactly as directed. 1:3 take medications as directed 80 to 90% of the time. 1:3 take medications 40 to 80% of the time. The remaining 16 to 17% take medications as directed less than 40% of the time. 20% of prescriptions are never cashed.
Mhm. So you see, so the effectiveness of prescription is only 50%. So, so I was surprised that 20% of patients do not buy the prescribed medication. So they just go to the doctor, they just get the treatment. The doctor prescribes the medication, but they don't follow his advice. So what do you know anything about similar statistics in your country, or what is your opinion? Is the statistics similar to that one of the United Kingdom, or is it different?
Ma'am, it is almost same.
It's a bit similar, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes.
Yeah, sure.
I also think so, that people are similar, and their attitude to this issue is
That's similar psychology.
the same. Okay. Well, and what should we do in this situation? So how should we improve concordance? So there is information, I mean, there is the article here, which we are going to read. And so it gives some advice about improving concordance. Now let us read it. And the first part of the article is for Arun Chalam. Read it, please.
Yes, ma'am. Reading concordance. The non-compliant concordance. The non-compliance in non-compliance in medicine taking is a long-standing problem in all therapeutic areas, including the treatment of cancer. There is strong evidence that despite the introduction of new medicines which have fewer side effects and more convenient to use, many people still do not take them as prescribed. Even when not doing so can have life-threatening consequences.
So what illness is mentioned here?
Cancer.
Cancer. Yes.
Cancer.
And what medications are mentioned here?
Therapeutics.
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 Yes. New medicine. Yes, new medications. Okay. So is everything clear here?
Yes, ma'am.
Okay, so the next part of the article is for Madhumita. Yes.
Medicines prescribed for preventive purposes are especially likely not to be taken as prescribed. This may be because people do not feel immediately threatened, and in case of symptomless conditions such as raised cholesterol levels and hypertension, feel no obvious benefit at the time when medicines are taken.
So preventive purposes. What does it mean, preventive purposes?
In case, ma'am, like
before
if the disease.
Yes, before something serious happens. Okay. Well, then if we move to the next slide, let us listen to Priya, please.
Yes, ma'am. Factors associated with poor compliance include, first one is complex regimens involving multiple doses and several medicines. And second one, unwanted side effects, concerns about the value or appropriateness of taking medicines in particular contexts. Denial of illness, especially among younger people, and confusion of physical difficulties associated with medicine taking, which mostly frequently affected older people.
So among the factors is the age of patients, yes? So how the age is connected with the poor compliance. So young people do not, for example, take because they deny the illness, And so older people,
Confusion
confusion.
or physical difficulties.
Yes, physical difficulties when they take medicine. Okay. So that was Priya, and now let us listen to Prerna. Read it, please.
Yes, ma'am. Effective ways of improving compliance rates involve the complementary use of educative, practical, and emotionally and behaviorally supportive interventions rather than the provision of information alone. There is evidence that regardless of the specific knowledge imparted, self-management programs which help to raise people's sense of self-efficacy and confidence promote better medicine taking.
So it's not enough just to give information, to say to the patient how this medicine should be taken, but what should be also done?
They should educate about the side effects, about the medicine.
And self-management, as you see, is also important. So
this has, if a person is educated and he is educated about the medicine and how to take care, then self-management will also occur, I think.
Exactly, you're right. Okay. Well, and so the next piece of information, Nishat, please.
Yes, ma'am. Health professionals should respect patients' autonomy and accept the increasing compliances with prescribing instruction is not as important as meeting patients' individual needs and priorities. Patients need help to make informed choices about treatment. For example, there is a need to differentiate clearly between situations where varying the timing or quantity of medicine, the doses may do a little harm or even be beneficial, and in situations in which there is a high probability of of adverse clinical outcomes.
So you see that individual needs are very important.
Yes,
not just okay, and so
and
patients
also doses of quantity and timing should be considered, as it may do some little harm or it may be beneficial.
Okay.
It is saying about that.
It depends on the medicine, right? Sometimes it's okay to change the timing and the dose, but in some cases it's very important because it has there is a probability of adverse clinical outcomes. Okay, and so the last piece of information, Sanhita.
Yes, ma'am. Improvement in self-management, skills and complements in medicine, taking can generate significant benefits for individual and the population as a whole. Combining medication reviews with other forms of timely and appropriate support for patients and carers represent as an important route towards better and more cost-effective uses of medicine.
So here this is the way to improve concordance, as you see. Yes, the self-management, support for patients, and so on. Okay, so and if we move to the next slide, we can see several questions to the text. So let us listen to Rafael. The first question is for you, please.
Yes, ma'am. What features of new medicines should make people the medicines prescribed to them? What features of new medicines should make people take the medicines prescribed to them? Ma'am, there are many ways such as involving the complementary of education, ma'am. Then ma'am, first of all, it is education. Then practically and emotionally. then also supporting by in the behavioral aspects, ma'am. And
So
so if we
here,
make all this,
according to the article, what features of new medicines can just help
Fewer
improve?
side effects.
Yes, new medicines which have fewer side effects and more convenient to use. So these features are more attractive to patients. Okay. Mhm. Well, I see that we have only 1 minute left. That is why just okay. Let us take a 10-minute break and see you in 10 minutes.